Hello to everyone and welcome to another video with Hypnotherapy Training International. And today's topic, it's a topic of how to deal with pressure or challenges during a therapeutic session. So you may be sitting there with a client, and as we're dealing with hypnotherapy, with the mind, with real people, real life situation, how you may handle and what the training also, how much it comes into play here when someone has an unusual reaction or not responding, or maybe someone's emotions are bursting out, or maybe they're trying to deflect on you their feelings. So Dr. John Butler, if you can please talk to us a little bit about reactions, pressure during therapy on the therapist, and things like that, that would be much appreciated.
Okay, thank you, Idan. Again, key points to look at for that would be to making sure that in your early stages of dealing with the client, even when they ring you up on the phone and they want to know about how you work and so on, that your training has equipped you to make some good early assessment of the client, their state, how much of issues they might be carrying that you know you can deal with them in your scope of practice, that you are not getting beyond your level of competence, and if later you discover that's the case, you're able to refer them on appropriately to more advanced help, more specialized help, and so on. So there are different causes of problems, and that's what we need to look at, of course. A client may have an abreaction in the session, you know how to deal with that, and hopefully because of your training and having worked on yourself, because it might be a very powerful abreaction. Now, it could be, as more commonly, we're dealing with their issues of what used to be called transference and counter-transference and counter-counter-transference. We're dealing with people's projections, including their manipulations, problems that they're not dealing with in themselves, get projected out to you. The seductiveness of the client. It doesn't mean necessarily sexual seduction, but there's fascinating examples where clients have later on in the sessions revealed how much they were trying to manipulate the therapist because of their own lack of development in certain areas. So the therapist needs to be sensitive, aware, strong enough to deal with these issues, to deal with the secondary gains and maybe some more severe personality disorders they have. Maybe elements of psychosis in some cases, paranoia, and being aware of the signs and being able to help the client without getting frightened or angry and doing things which are counter-therapeutic. So you're doing your therapy as well as possible. The inner strengths of the therapists are there, they've worked on themselves, they use a lot of their own self-hypnosis, they're good at keeping the boundaries, helping the client take responsibility for change, and working well with homework, and all the time building a good therapeutic relationship with that client. Now, therapists need support, help for themselves from within, help them deal with difficult clients. I've worked with some who have a lot of violence issues, very deep emotional traumas and problems from their past, and that requires a lot of careful handling of the client. And not being sucked into the manipulations. The clients who are therapist defeaters, that's part of their achievement, as they feel. I'm showing I can't be helped. And maybe they may have psychopathic, sociopathic at least, tendencies which they're there really only because of other people. But of course that's not admitted. They may have rejection issues, which is great fear of rejection. So they're putting a lot of demands and pressure on you. Maybe they ring you all hours a day and night, expect you to jump to their tune, be available always. And they may be complaining a lot about their partners or other people. They can be complaining about all the previous therapists who weren't good. And they can be complaining about you too in no time. So they need help. And you need to be able to deal with them as best you can. It's a two-person approach. If the client is not making those kind of commitments, over a period of time, you need to be able to withdraw and get them in an appropriate manner from being sucked into being dominated. exploited as a therapist or even abused. Excuse me. You may then be in a position where at a certain point it's just that not working out for you, that the personalities are so different that it's better that they are with a different therapist. And there's nothing wrong with that as long as you can acknowledge that. You're just not a very good fit. And so on. Now, what the truth of the matter, of course, is that a good therapist doing their very best, doing very good work, is going to help most people. And we can't, and it's not a blame game. Say that this is the client always manipulating, and demanding and abusing the therapist in more subtle or more not so subtle ways. I've had clients who've tried to frighten me because with how violent they were, and they've admitted it, and so on. And so you can be dealing with, through your career, some very extreme cases. Most time we're not dealing so much with that. But issues of dependency and codependency, and expecting the therapist to be the father, mother they never had, which some of that role, of course, we play in helping them get started, but then we must withdraw. And they may not want that. And then at some point, you may have to say to them, the readiness for change isn't there yet, in my opinion. You say in the most appropriate, careful way. You're on a journey to getting ready for change, and that's fine, because most people are not really ready for change when they come for therapy, despite what they say or think, but they're getting ready for it. And you help them on that basis, and then very quickly, once readiness for change is there, change occurs. So that's the marvellous potential for therapy to help people. However, the therapist does have to be able to deal with all of those complexities I've mentioned that can arise during a session or between sessions. So, and we cover those issues quite a lot on our analytical hypnotherapy course, so-called Advanced Analytical Hypnotherapy, and our Clinical Hypnotherapy course, and subsequent training specialist classes that we run as well. So, thank you very much for listening and watching.